Morning, everybody. Let me just get my presentation here. I have the pleasure of introducing a very interesting case study, a video by Dr. Anand Vinekar. We are a company based out of Bangalore, and we specialize in software solutions, healthcare solutions, specifically targeted for telemedicine. And what I'm going to share with you is a very interesting case study of applying, like Richard said, technology disruptively in the application of actually preventing infants from going blind. But before I actually show you the video, I wanted to share with you a perspective of what we consider to be the major challenges of telemedicine and telemedicine 2.0. I've lost my voice here. Can you hear me at the back? Yeah. Basically, if you look at the proverbial pyramid, there is a top 10% which we consider to be connected or and overserved. By overserved, I mean these are the major big hospitals in the major metros, and then they're very well both staffed, and they have excellent equipment in India. And if you visit one of these places, it's very difficult to escape without having some part of your body X-rayed or MRI'd, whether you need it or not. So that's why I call it kind of overserved. The middle bit is really the middle income groups in India, the tier 2, tier 3 cities, where you see a lot of small clinics. And really, if you look at the problems that people are trying to solve, the top bit is all about outreach. How can I get more patients? Maybe even from other countries coming from for treatment in India. But the middle bit is really about scalability. How do I take this small clinic and get more and more patients reported? But the bottom bit, or the base of the pyramid, the 60%, that's about 4-point-something billion people on this planet, are really unconnected and unserved. And that's where I think where the most amount of innovation, the challenges are really coming. And I'm really excited, especially to be in India, working here with, because if you look at some of the work that's going on in Arvind Eye Care, and also, you heard yesterday Dr. Ganapathy talking about, telemedicine. I think there's some very interesting, models, being actually being worked out in India. What I'm going to share with you is really a very interesting case where the problem is that there are about 30 million, roughly, kids that are born in India. And about 2 million of them every year have the potential of going blind. And the people who can detect, this blindness, there are only about 18 experts in India. So just look at the equation: 2 million to be screened, and 18 doctors. So here's the film that talks about how this is being done. Can I have the volume, please?
At the outset, I would like to thank the organizers of the International Telemedicine Congress 2011 for this opportunity. The need for telemedicine today is better understood by understanding the problem statement. In India and in other middle-income countries, those who need medical treatment have poor access to the medical experts. These could be because of barriers of geography, culture, but mostly finance. That's where telemedicine bridges this wide gap. While telemedicine has moved from poor video conferencing to live telemedicine version 2.0, we are happy to be part of this revolution. For over 5 years now, we have been building on the tenets of telemedicine, teleophthalmology to be more precise, to provide to the rural masses subspecialty eye care services. KIDROP, or Karnataka Internet Assisted Diagnosis for Retinopathy of Prematurity, has been created to provide subspecialty care to the rural masses is our flagship teleophthalmology program, which I will now detail to illustrate the possibilities in teleophthalmology. Over 27 million babies are born each year in India alone, and over 2 million of these are born below 2,000 grams, putting them at particular risk of a condition that can cause severe, permanent, and irreversible blindness called ROP, or retinopathy of prematurity. Fortunately, ROP does not affect all these tiny babies. Its incidence in India as a disease is pegged at about 47% in Indian babies, and fortunately, only around 10% risk blindness. However, the good part of this fact sheet is that blindness is preventable if this disease is diagnosed and treated on time. The unfortunate part, however, is that there are less than 18 ROP experts in the country today. Using them to reach 2 million would be impossible. That's where tele-ROP, or the KidDrop initiative, comes in. Under KidDrop, we have trained technicians to capture the retinal images of premature infants in their resident hospitals in the rural areas, triage these images, and then upload it on a secure platform that allows work lists and patient data to be preserved, protecting the confidentiality of these patients, and at the same time providing an easy to use interface both at the technician end and the remote reading site. The remote reader in this case is an ROP expert who gets access to these images using his PC or the smartphone, which we put out in 2009, literally anytime and anywhere. More recently, we have added to this repertoire the tablet. Today, mobile health, with the introduction of some very new tablet platforms like the BlackBerry Playbook, is moving from being just connected technology to being more collaborative due to more ubiquitous access and sharing of medical data and images. By sharing data on the move, with instant video calls with the patient or even a colleague to clear up doubts, telemedicine 2.0 has taken a giant leap forward. Another recent innovation we have added is decision support on the mobile platform. For instance, the standard images can provide much more information by using customized image enhancement tools, which help the clinician in both routine work and with research possibilities. In the past, these tools were possible only on specialized equipment, not accessible to many. One of the greatest things that we can do here is multitasking. As you can see that here I'm looking at a baby's images of last week, and I can see a little bit of disease here, but I'm also looking at a lesion here which is making me suspect that this child could have infection or sepsis. So what I do is I just toggle between this application and the real-time video application where I can actually talk to my team who's in the rural area. And here now I'm just asking them if they can find out if this child has sepsis. Sure enough, I'm typing this and I'm also speaking this out. And a minute later, they find out that yes, indeed, this child does have sepsis. So I'm back now comparing this image, and I find that actually today's images show that the disease has actually progressed. And I think that infection has played some role. So here's the team actually asking me what can be done and what they should do now. And so I give them some instructions like, when the child needs to be followed up again, and some blood investigations that have to be done as well. And at the end of the day, I can actually compare many times over last week's visit and today, and absolutely confirm that this child has indeed progressed even as they are imaging this, even before they've actually uploaded these images on the server. And after doing that we can actually make a report, and then they have it right there. And the same video application can be used for me to speak with the mother as well. So I have the baby's images showing up on the left panel, and I can swap between the video application and the eye-to-eye application, where I can actually speak with the mother and reassure her that her child is doing better, or sometimes I need to tell her that this baby needs treatment, and I can counsel her either way, depending on what we see here. And then they get a lot of confidence because they feel that they have sort of almost seen the doctor real time, even if I'm sitting very remotely. And that's probably the biggest advantage, that without actually having to minimize any of these windows, I can do a lot of multitasking, and that's a really important feature. As responsible physicians, data security and data management are of paramount importance both for live interactions and collaboration. Also invaluable is data mining and correlation for research and training. All this is possible on today's mobile platforms like BlackBerry Enterprise Service. As healthcare providers, we at Narayana Nethralaya are blessed to be partnering with the National Rural Health Mission, NRHM, Ministry of Health, in a public-private partnership that has adopted 12 more districts of rural Karnataka. In a short span of just 4 months, we have successfully completed 1,000 imaging sessions, found the disease in 27% of the babies imaged, and provided free treatment to all those babies who needed it without them having to leave their rural homes. This would not have been possible without teleophthalmology and without our IT partners, Eye2Eye Telesolutions, who have helped us develop and deploy technological solutions which have enriched the lives of our patients in remote rural areas. We at Narayana Nethralaya are happy to be amidst this technological revolution that integrates cutting-edge medical technology into telemedicine. We hope to continue to participate, innovate, and execute all that is required to improve the lives of our patients in remote, inaccessible regions in our part of the world, and partner with like-minded organizations in other regions of the globe. Once again, I thank you for this opportunity.